when moral status depends on the mind. One of the most influential and most controversial ideas in modern bioethics is the claim that not all human beings have the same moral status. That statement alone should make us pause. And yet, it lies at the heart of what is called cognitive capacity or personhood theory. Its core claim is this: only beings with certain advanced mental capacities have full moral status. Moral worth, on this view, does not automatically follow from being biologically human. It follows from being a person, and personhood is defined not by species, but by the mind. Personhood theory asks a very specific question: what kind of being can be wronged in the fullest moral sense? Its answer is not any living human organism. Its answer is a being capable of certain psychological functions. The most commonly cited criteria include rationality, the ability to reason and deliberate; self-awareness, recognizing oneself as a subject over time; autonomy, the capacity to make and act on one's own decisions; moral agency, understanding moral reasons and responsibilities; future-oriented preferences, having interests that extend forward in time. Together, these traits define what personhood theorists believe truly grounds moral status. To be a person is not merely to be alive. It is to be a subject, a chooser, a planner, a reason giver. This framework has enormous intuitive appeal in modern liberal societies. We routinely tie moral and legal responsibility to mental capacity. We do not hold infants criminally liable. We do not treat unconscious patients as autonomous decision makers. We do not assign blame where rational control is absent. Personhood theory gives philosophical structure to these everyday judgments. One of its greatest strengths is that it explains moral responsibility. Only persons on this view can be held accountable. Only persons can consent. Only persons can refuse. Only persons can be blamed or praised. This is why the theory integrates so smoothly into law and medical ethics. Capacity assessments, informed consent, competence hearings all presuppose that moral authority flows from cognitive ability. Personhood theory also grounds autonomy-based ethics. If what matters morally is self-direction, then respecting autonomy becomes central. Medical paternalism looks morally suspect. Forced treatment becomes ethically dangerous. Patient choice becomes paramount. This is why personhood theory dominates much of liberal bioethics. The ethical patient is imagined as informed, rational, reflective, capable of articulating preferences, and ethical medicine, on this view, exists primarily to respect those preferences. The theory is also often invoked in abortion and euthanasia debates. If moral status depends on self-awareness, rationality, or future-oriented preferences, then early fetuses may not qualify as persons. Similarly, if those capacities are permanently lost, some argue that personhood, and thus full moral status, has ended. This is not a fringe view. It is one of the most philosophically developed positions in contemporary ethics. But this is also where the theory reveals its deepest fault lines, because once moral status is tied to mental capacity, it becomes variable. And variable moral status leads to a dangerous conclusion: not all humans are moral equals. Infants, on strict personhood accounts, are not yet persons. People with profound cognitive disabilities may never meet the criteria. Patients with advanced dementia may fall below the threshold. The permanently unconscious may be excluded entirely. This is not a misunderstanding of the theory. It is a direct implication of it. Defenders sometimes respond by introducing thresholds or proxies. They say, we treat infants as if they are persons, or we grant moral status by social convention. But these moves quietly concede the problem. If personhood must be supplemented by convention to protect the vulnerable, then personhood alone is not doing the ethical work. This leads to one of the most serious critiques. Personhood theory risks a graded humanity. Moral worth increases or decreases with cognitive performance. Those at the top, autonomous, articulate, rational adults, receive the strongest protections. Those at the margins depend on advocacy, sentiment, or policy rather than principle. History has taught us what happens when moral value is graded. This is not merely theoretical. Personhood-based reasoning has been used explicitly or implicitly to justify institutionalization, forced sterilization, denial of care, exclusion from moral concern, often in the name of rationality, often in the name of progress, often in the name of compassion. The theory's critics argue that once we detach moral worth from being human, we open the door to exclusionary practices, even when intentions are good. There is also a deeper philosophical concern. Personhood theory struggles to explain why loss of capacity should equal loss of worth. If someone is injured, do they become less valuable? If autonomy fades, does dignity fade with it? If the answer is yes, then moral worth becomes fragile, dependent on neurological fortune. For many ethicists, this feels profoundly wrong. And yet, despite these critiques, personhood theory remains powerful because it captures something real. There is a moral difference between choosing and being acted upon. There is a moral importance to self-direction. There is something distinctive about beings who can understand reasons and shape their lives accordingly. The question is not whether cognitive capacities matter. The question is whether they should matter this much. Most contemporary bioethics operates in tension here, between protecting autonomy and protecting the vulnerable, between respecting persons and preserving human equality. Personhood theory forces us to confront that tension honestly. It leaves us with a question that cannot be avoided. If moral worth depends on mental capacity, what happens when the mind fails or has not yet arrived? How we answer that question determines not only our ethical theories, but how we treat the most fragile among us. And that is why personhood theory remains one of the most consequential and contested frameworks in all of bioethics.